Hello and welcome to Pisgah Health Today. My name is Angela Owen. It is my privilege to host this program brought to you by the Pisgah Health Foundation. The Pisgah Health Foundation is a public 501c3 charity founded in 2019 by a board of 7 caring individuals committed to improving the health, wellness, and lives of Western North Carolina residents. Our special guest today is Dr. Ginger Poulton. She comes to us from Mountain Area Health Education Center, also known as MAHEC. Welcome to our program today, Dr. Poulton.
Thank you so much. Glad to be here.
Dr. Poulton is a family medicine physician in Asheville, North Carolina. She graduated from the University of Michigan Ann Arbor Medical School in 2010, and before that, she received her master's in education as a part of Teach for America. So a great broad background that she brings. She is married. She has 2 sons, ages 6 and 8, a full, rich life, and we are certainly thrilled for what she is doing there at MAHEC. Welcome again, and why don't you start by just telling us a little bit about MAHEC and what is MAHEC? What would our audience need to know about this organization?
Oh, great. So MAHEC, like Angela mentioned, it's the Mountain Area Health Education Center, and it is, for me, it's mostly, I think of it as a residency program, though MAHEC does a lot of wonderful things in the community. I came here for my residency from the University of Michigan in 2010, and since then, MAHEC has grown a lot. There's about 500 or 600 employees at the organization, and we have residency programs in family medicine, OB-GYN, psychiatry, general surgery. We're adding a transitional year in internal medicine as well. So MAHEC really trains a wide variety of doctors, and so many of them stay in Western North Carolina, which is wonderful. I'm one of them because I stayed on as faculty after I graduated in 2013. And we're really invested in the community. We take all types of insurances, including patients without any insurance, and have sliding scale fees. So we work with everyone.
What a fantastic organization providing health, wellness, and education components. Dr. Poulton, tell us a little about the grant that MAHEC received from Pisgah Health Foundation and what that grant is going to enable you to do in Western North Carolina.
Yeah, so one of my, it's a long story because it's a long answer in some ways. I've always long been a really active runner, into yoga, bicycling, used to rock climb and do all sorts of things. And I've always kept that as a part of what I've done in medicine, and then really become interested in whole food, plant-based diets, and seen all the great evidence for that, for patient health and well-being. And along those lines, I found lifestyle medicine, which is a board specialty that started back in about 2004. It has wonderful evidence for showing how a whole food, plant-based diet, regular exercise, nutrition, having stress management, and really strong social relationships and avoidance of toxic exposures like cigarettes and alcohol and other chemicals can help patients thrive. And it's just really a perfect paradigm. It's really exciting. It's really the wave of the future. It's what Kaiser Permanente recommends for all of their insured patients, which is Kaiser's game is to save money, right? They want to save money for them so they can fill their own pocketbook, right? And they also recommend this type of thing. So the lifestyle medicine residency curriculum is a program through the College of Lifestyle Medicine that allows us to train our resident physicians at MAHEC in these tenets of lifestyle medicine so that they can go out and help counsel their patients on these really important topics. And any one physician, I might quote this statistic wrong, but over the course of their career, depending on how many patients they see, but they have 100,000 interactions with patients, right? It may be similar patients, but it's 2,000 patients a year, and you're doing, easily 50 to 100 visits a week. It's, you can really make an impact when you do this continuous counseling with patients, and then they can be advocates too. So through the Pisgah Health Foundation, I needed some time to organize this curriculum. I needed a small amount of money to pay for the curriculum itself. And so through that grant, it's just been wonderful to have that time. Lest I go on, I'll tell you that even last night, what we did at my house, because of the pandemic and because the curriculum is new, we can't give all of the lectures during the regularly scheduled didactic time. And so I said, well, I have this grant, it's supporting me, our things are different. So I actually had the residents over to my back patio, and we all wore masks, and we sat outside and did our lifestyle medicine learning outside with a whole food plant-based dinner. Very much thankful for the Pisgah Health Foundation supporting us in doing that.
I love that example. And I love what I hear you describing with this approach to lifestyle medicine, with it really being a holistic wellness approach rather than simply treating a symptom or just treating something to be able to maybe make it feel better, right? You're helping to actually be better, get better. Am I interpreting that correctly, Dr. Polton?
Yeah, definitely. I think sometimes the analogy I use is that I think so often in medicine we kind of have this treatment triangle where at the base really should be lifestyle medicine and having patients eat a healthful diet and do regular physical activity. But so often we just jump, and then above that is like things like physical therapy because your back hurts. But so often we just jump to, you know, here's your narcotic, here's your gabapentin, here's your meloxicam and cyclobenzaprine, and then why don't you go get an epidural injection? And so if we really start at the base, it makes everything stronger. And I think of it that just like building a house, like you wouldn't all of a sudden make this amazing third story addition when your foundation is crumbling.
Right.
So like it doesn't make sense to have our patients take a cholesterol medicine with a Big Mac and fries, right? Like it just doesn't go together so well.
Oh, very, very great analogy there. I love that analogy. How have you seen the practice? What have the impacts of COVID-19 had on how you engage with different people who come through the practice?
Yeah, so well, that's definitely, I think COVID-19 has, MAHEC, I will say, has had an amazing response to COVID-19. We're seeing patients in our parking garage, covered outdoor space, swabbing patients for COVID. We've created a whole clinic, and my colleague, Dr. Putnam, is in charge of that. I get to do shifts there as well and help evaluate patients. It's certainly changed. There's been a lot of workflows around that have been really powerful. And even like this type of thing, telemedicine and WebEx and Zoom are all just so useful right now. I mean, the other day I had a meeting with some of my colleagues, and one was in Milwaukee, the other was in Pennsylvania. Two of us were on other, sides of town, but we all could get together for 20 quick minutes. It was really amazing to really hammer out things we needed to do. I think as it may relate to lifestyle medicine, I know for some, it's an interesting time because I've certainly had some patients who are like, I'm so stressed I went back to smoking. And it's like, that's just the worst thing you could do in the middle of a pandemic that affects your lungs and can cause permanent lung damage. And also it's part of that stress response and recognizing that and meeting the patients where they are and figuring out what we can do to support them to, just yesterday I said, well, so you're smoking now. Do you want to be smoking in 5 years? What about at Christmas? Oh no, I want to be done by Christmas. Okay, well, we're narrowing in on giving you an accountable time to stop. So it's definitely been challenging for our patients, but it's also been an opportunity for some people to realize, wow, patients who I'm hearing in the news that when you're overweight and you have diabetes and hypertension, you're more at risk. So I really want to get rid of these conditions now. How do I do it? This is a call for me to be more healthy and better call to action.
Some great motivation there along the way. Not the kind we necessarily want to have, but at least it's motivating people. Well, Dr. Polton, what else would you like for our viewers to know and understand about MAHEC and how they can support or get engaged or get in touch with you in the organization?
Yeah, so I would say, well, MAHEC, we're accepting new patients. I've been working here for 10 years. It's a long time. I think the innovation here is really second to none. And I am getting support from my colleagues and my directors in furthering lifestyle medicine. We're going to have residents who are all trained in this so they can really be a source of health and wellness for our patients. And we have, of course, a website, just www.mahec.net, and you can find all of our residency programs there and request things as a patient, or if you're a budding medical student wanting to come here. We also have a lot of programs, so I'll have high school students who shadow me from time to time, as well as other members in the community.
Fantastic. Well,
Yeah.
the board of directors at Pisgah Health Foundation, along with the rest of us, we're super grateful for the work that you and the organization are doing, your focus on lifestyle medicine and helping with the residencies, putting together that curriculum and helping so many people here in Western North Carolina find a healthier lifestyle so that we
Yeah.
can, in the words of our Blue Zone compadres, live longer, better, right?
Yeah, that's right. We want to live longer, not make it just seem like it's longer.
Exactly. Live longer,
Yeah.
better. Well, thank you
Right.
so very much for taking time to be here today. We really greatly appreciate it. There's so many great aspects about MAHEC. Would love to have you back on the program maybe later on once you get a little further
Yeah.
into the curriculum and we can unpack a little bit more there.
Great. I would love that. Well, thank you for all the work you're doing. I am so thankful for the Pisgah Health Foundation. It's wonderful for me personally, it's wonderful to share with the residents, and I just look forward to seeing this grow throughout the region.
Fantastic. Well, thank you again. We also want to thank Wildflower Media for their technical and creative support, along with the board of directors and the staff at Pisgah Health Foundation, as well as the Physicians Roundtable. So many great people doing wonderful things to help improve the health, wellness, and lives of Western North Carolina residents. And to our viewers, until we see you on the next Pisgah Health Today, please stay well.
Okay. Thank you.